adrenal medulla. Give it. Adrenal medulla. Ekkada poyindi adrenal. Idi. Give. దాని కింది దాని కింది కొంచెం పెద్దగా చేయాలి దీన్ని. ఇక్కడ అది అయిందో లేదో చూసినాక అక్కడ వస్తుందా లేదా చెప్పు. ఒక్కోసారి వస్తలేవట క్లాసెస్. మళ్ళీ నాకు వచ్చి చెప్పు. అయ్యో మళ్ళీ పోయినా. యూట్యూబ్లో పోవాలి కదా.
ఆల్రెడీ చేశారు మేడం కదా. వస్తుంది ఆల్రెడీ స్టార్ట్ చేశారు.
చెప్పొచ్చా? ఇది టాపిక్ అయితే ఇది స్టార్ట్ చేయొచ్చు కదా.
ఆల్రెడీ స్టార్ట్ చేశారు.
Good morning everyone. Today I am going to talk about adrenal medulla. You have finished about the outer zone, that is the adrenal cortex. Now we have come to the inner zone, that is adrenal medulla. Okay, as you all know, this adrenal gland is present on the upper pole of the kidney. It has got the outer cortex and the inner medulla. So the whole of this adrenal gland weighs about 5 grams. And only the 20 to 30% of that inner mass is the adrenal gland, adrenal medulla. So the whole of this will weigh about 5 grams. 4 grams is your adrenal cortex and 1 gram will be adrenal medulla. Unlike hormones of adrenal cortex, adrenal medullary hormones are not essential for life. Adrenal cortex hormones are very essential for life. Aldosterone is the most important hormone of adrenal cortex. Okay, so unlike hormones of adrenal cortex, adrenal medullary hormones are not very essential for life, but they are important to us during the emergency situations. For emergency situations, they are important during emergency situations. Adrenal gland by adrenal medulla by secreting catecholamines. Whatever I am talking is adrenal medulla. I am not at all talking anything about the cortex. Whenever I say adrenal gland also, it is you imply to adrenal medulla. So adrenal medulla by secreting catecholamines is very essential in fight or flight response. What is fight or flight response? Either you fight with the enemy to finish the enemy, or run away from the enemy, or run away, flight, run away from the enemy to protect yourself. So these hormones are very essential for fight or flight response. And one more important thing about this adrenal medulla is it is very essential in meeting the metabolic requirements of our body, like hypoglycemia. But I'll come to it a bit later. So requiring to assist our body in meeting the metabolic requirements of the body, that is hypoglycemia. So adrenal medulla has got cells. These cells are called chromaffin cells. Why are they called chromaffin cells? Because they have affinity for chromium states. So they are called chromaffin cells. Inside these chromaffin cells are the granules. These granules are present in the vesicles and they store catecholamines. So these granules store catecholamines. Okay. So adrenal gland is innervated by, okay, coming to the next slide, the medulla is the inner part. We are talking only about the inner part, that is about 20 to 30 grams. only 20 to 30% of the total mass of the gland. Only 20 to 30%, and it weighs about 1 gram. Adrenal medulla, innervation of the adrenal medulla. Adrenal medulla is innervated by, it is called splanchnic nerves, thoracic splanchnic nerves. So thoracic splanchnic nerve, which is starting from the this thoracic splanchnic nerves, these are starting, so look where the cursor is. So it is starting from the lateral horn of the spinal cord. So one is the anterior horn, posterior horn, lateral horn of the spinal cord. So lateral horn of the spinal cord, it is starting between T8 and L1 and going via this ventral root, anterior root or ventral root. Ventral root, it is crossing the sympathetic trunk and along the blood vessels. This is going and innervating the chromaffin cells. These cells are the chromaffin cells, okay? It is innervating the chromaffin cells. These are the preganglionic neurons. Preganglionic neurons. So what happened to the postganglionic neurons? Postganglionic neurons are not there. These axons have, the neurons have shed their axons and they are embedded in these cells and they become secretory cells or endocrine cells. Okay, there are no, only preganglionic fibers are there. Postganglionic fibers are not there. So the postganglionic fibers, where did this cursor go? These postganglionic fibers are embedded in these cells and they become your endocrine cells or secretory cells. Okay, so usually sympathetic and parasympathetic, when you read about the autonomic nervous system, you will know how these fibers are. Okay, so it will have preganglionic fibers and mostly the sympathetic fibers are all end up in the sympathetic trunk and postganglionic fibers come from there. But usually, in this adrenal medulla, preganglionic fibers are very long. They are crossing the sympathetic trunk and they are ending on this medullary cells. Okay, we do not find the postganglionic fibers. They, the axons, the neurons have shed their axons and they have become the endocrine cells. Okay, what are these preganglionic fibers? These preganglionic fibers, these are preganglionic cholinergic innervation. So, when I say cholinergic innervation, it means they release acetylcholine. So, these preganglionic fibers are usually cholinergic innervation, be it in sympathetic or parasympathetic. Okay, so this preganglionic cholinergic innervation is there to the medulla. That means acetylcholine is released when sympathetic system is stimulated, the adrenal gland gets activated and they release acetylcholine because they are preganglionic cholinergic innervation. They release acetylcholine. Once when the acetylcholine is released, they stimulate these chromaffin cells. And these chromaffin cells, there will be inward movement of calcium and by exocytosis, this catecholamines are released into the venous sinuses. They are released into the, and by exocytosis, when this preganglion cholinergic cells are stimulated, they release acetylcholine. This acetylcholine will stimulate these chromaffin cells. And these chromaffin cells, there will be inward movement of calcium and by exocytosis, the catecholamines are released into the venous sinuses. So, in between these chromaffin cells, these venous sinuses are present. Venous sinuses are nothing but they are also type of capillaries. Capillaries, there are again three types. One is the continuous capillaries, one is discontinuous capillaries, and one is fenestrated capillaries. So, this discontinuous capillaries or sinusoids are present in this adrenal medulla. So, once and it will come into the venous circulation and they are taken up by these capillaries. Okay. So, once they are by exocytosis, once this catecholamines are released, they come into this circulation. Okay. So, whenever sympathetic system is stimulated, adrenal gland is also getting stimulated. So it releases from the adrenal gland, mainly adrenaline comes out of into the circulation, and there are some neurons, sympathetic adrenergic neurons are there. Sympathetic adrenergic neurons, they will release, they can release adrenaline or noradrenaline. When we say sympathetic noradrenergic neurons, they release noradrenaline. So whenever sympathetic sympathetic system is stimulated, it is activating the medulla. This medulla can release adrenaline from the adrenal medulla, and also non-adrenaline from the sympathetic adrenergic neurons. So sympathetic noradrenaline releases into the circulation bit slowly, whereas this adrenaline releases into the circulation very fast. Okay, so this will release it into the circulation. Here what you should know is preganglionic sympathetic cholinergic fibers. Preganglionic cholinergic innervation to medulla. So acetylcholine is released. Okay, we do not have the postganglionic fibers. They are not there and they become the endocrine cells. So more or less we can say adrenal gland is a sympathetic ganglion. It is a sympathetic ganglion. See, this is where it is located, on the upper pole of the kidney. The outer one is the cortex and the inner is the medulla. And looking at this medulla, looking at the vesicles also, though this diagram is not that clear, looking at the vesicles also, we can say whether they are secreting adrenaline or noradrenaline. Adrenal secretion, the vesicles are usually large and the granules are large and they are less dense. They are large, less dense, and they completely fill up the vesicle. Those are adrenal secreting granules. Noradrenal secreting granules, the vesicles are small, they are less dense. They are, adrenal vesicles are large, less dense, and they completely fill up the vesicle. Whereas noradrenal secreting type are dense, and they are dense, they are small, dense, and they do not fill up the vesicle. Looking at the vesicles itself, we can say whether those vesicles are releasing adrenaline or noradrenaline. And also we do not know how the DOPA vesicles look like. Not very clear idea about how the DOPA vesicles look like. Unfortunately, I do not have the diagram how the vesicles look like, but you imagine how. And another word for adrenaline is epinephrine, and for another word for noradrenaline is norepinephrine. Norepinephrine. They are one and the same. Don't get confused. So catecholamines. What are the catecholamines? Catecholamines are adrenaline or epinephrine, noradrenaline or norepinephrine, and dopamine. These are the catecholamines. Catecholamines are epinephrine, norepinephrine, and dopamine. Looking at the vesicles, I told you how they look like. So innervation, I told you, innervation you should remember. And catecholamines means first and foremost thing that should cross your mind is fight or flight response. If you know that, you can write an essay on this catecholamines. If you remember that one word, you can write. And that is what is happening in our emergency situations. So body is coping up during emergency situations because of this catecholamines. Okay, how are synthesis of adrenomedullary hormones? Phenylalanine. It is usually present in our diet. Phenylalanine, in the presence of phenylalanine hydroxylase is getting converted to tyrosine. And tyrosine is getting converted in dihydroxyphenylalanine. Okay, so in the presence of tyrosine hydroxylase. Tyrosine hydroxylase is present in the cytoplasm of this chromaffin cells. Okay, and that in the presence of DOPA decarboxylase is converting into dopamine. This DOPA decarboxylase is also present in the chromaffin cells. And dopamine, in presence of dopamine beta hydroxylase, get converted to norepinephrine. And norepinephrine is getting converted to epinephrine in the presence of phenylethanolamine N-methyl transferase. All this will be dealt to you in biochemistry also. So, dopamine, dopamine gets converted to norepinephrine. Norepinephrine gets converted to epinephrine. Okay. This is synthesis. How is this metabolic degradation of epinephrine and norepinephrine occurring? This is mainly occurring in the liver and kidneys. Degradation. So, metabolic degradation is mainly occurring in the liver and kidneys. Half-life of it is very less, I think 1 to 3 minutes. So, epinephrine in the two important enzymes are needed. Co-methyl transferase and monoamine oxidase. Okay, these two important enzymes are required for epinephrine in presence of COMT metanephrine and in presence of monoamine oxidase to 3-methoxy-4-hydroxy mandelic aldehydes, and that is getting converted to methoxy-4-hydroxy mandelic. This is VMA is vandylyl mandelic acid. Okay, so same way, norepinephrine also in the presence of COMT is getting converted into normetanephrine, and that in the presence of MAO is getting converted into 3-methoxy-4-hydroxy mandelic aldehydes, and that in the presence of methoxy is getting converted to 3-methoxy-4-hydroxy mandelic acid, vandylyl mandelic acid. Okay, once all this is released, they are stored in the granules of the chromaffin cells. Okay, they are stored in the granules, and metabolic degradation occurs mainly in the kidney and liver. So, two important enzymes are there, COMT and MAO. So, for degradation, half-life of this is very less, 1 to 3 minutes. Okay, so when should this catecholamines release into the blood? Okay, into the venous sinuses or capillaries. When do they release? Regulation. So, whenever we are exercising, whenever there is hypoglycemia. Let me tell about hypoglycemia. So, hypoglycemia is a potent stimulator for catecholamines. Whenever our blood glucose levels drop below 60 milligram percentage. So, CNS receptors monitoring the blood glucose, particularly where are they present? They are present in the hypoglycemia. Glucose receptors in the hypothalamus, they get stimulated. During hypoglycemia, when the blood glucose levels drop below 60%, the CNS receptors monitoring the blood glucose get activated. When they get activated, they stimulate the sympathetic system, and sympathetic system by releasing epinephrine and norepinephrine increases the blood glucose levels. Okay, they will increase the blood glucose levels. So that is why hypoglycemia, if it is hypoglycemia bad, it might lead to death. So this sympathetic system is stimulated to increase the blood glucose levels. When the hypoglycemia means glucose in the blood is less. When the glucose in the blood is less than 60%, it will stimulate the sympathetic system. Okay. Trauma, whenever there is physical injury, trauma, your catecholamines will release. Fear, anxiety, anger, hemorrhage, lot of blood loss is there. Fluid loss, like dehydration, lot of fluid loss is there. Vomitings, dehydration, fluid loss is there. Asphyxia. Asphyxia means both hypoxia and hypercapnia. Decreased oxygen and increased carbon dioxide levels in the blood. Okay. Hypoxia. So, decreased oxygen levels in the blood. Exposure to extreme heat or cold. These are the conditions. All these are some are emergency conditions. So, all during these conditions, catecholamines are released. Okay. Fluid loss whenever this, and they will activate the sympathetic system. Okay, now fight or flight response. So, catecholamines are very important during fight or flight response. Fighting, you fight with the enemy and you finish the enemy, or you run away from the enemy so fast you have to run so that your like here I'm showing in the picture, so that lion will not catch you. Run away from the enemy to protect yourself. Okay, so this is fight or flight response. Either you fight and finish your enemy, or you run away from the enemy to protect yourselves. Okay, so it is fight or flight response. Whenever there is fight or flight, what happens in our body? So we have to see things clearly. So lot of light should enter our eyes. So we have to see things clearly. Okay. So letting more light to enter into the eyes by relaxing accommodation. By relaxing accommodation means accommodation muscles. Accommodation muscles are ciliary muscles. Okay. Ciliary muscles are relaxed. See, when ciliary muscles are relaxed, your suspensory ligament, which is attached to the ciliary muscles, will become tight. When this becomes tight, it will pull the lens. Lens will become flat. So you can see the faraway things clearly. Faraway things you can see clearly. So lens becomes flat. Okay. So if you want to see the near things, your lens should bulge to the front. That will come to it later in the next topics of special senses. But here, whenever I am saying relaxation, relaxing accommodation means relaxing of the ciliary muscles. Ciliary muscles of the lens. So lens has got some muscles and iris has got some muscles. So lens muscles are relaxed. When they are relaxed, they will pull the suspensory ligament tight. So when suspensory ligament becomes tight, the lens becomes flattened. So we can see far away things better. So that is relaxing accommodation. And producing pupillary dilatation. Pupillary iris muscles are like what is it called, dilator pupillae. Dilator pupillae or radial muscles. When these muscles, one and the same, dilator pupillae or radial muscles are one and the same. These are the muscles of the iris. So when these muscles are contracted, your pupil will dilate. So this is called mydriasis. Pupillary dilatation is called mydriasis, whereas pupillary constriction is called miosis. So pupillary, pupil will dilate. So when pupil is dilated, we can see things better. More light will enter the eye by relaxing accommodation and producing pupillary dilatation. So when you are running, you want better blood supply to your vital organs and muscles. You want better blood supply to your skeletal muscles. You want better blood supply to your heart. You want better blood supply to your brain. So providing better perfusion of vital organs and muscles. How? By increasing the heart rate and BP, which increases the venous return. Increasing the heart rate. CVS is not over for you. So whenever heart rate, stroke volume into heart rate is your cardiac output. Whenever the cardiac output is more, your venous return will be more. So by increasing the heart rate and increasing your BP, whenever your cardiac output goes up, your systolic blood pressure also goes up. Okay. So by increasing heart rate and BP, which will increase the, both this will lead to increased cardiac output. When cardiac output is more from the heart, more of the blood will be entering the heart also. Your increases the venous return. Okay. By stimulation of the sympathetic vasodilator system in skeletal muscle. Skeletal muscle, whenever you are running, our skeletal muscles need a lot of blood. So the sympathetic vasodilator system in skeletal muscle gets vasodilated. So we get good blood supply to the skeletal muscles, and limiting the bleeding if wounded by constricting the blood vessels. When the blood vessels are constricted, water blood is there also, it will not come out much. So limiting the bleeding if wounded by constricting the blood vessels. Reinforcing the alert and arousal states by decreasing threshold in reticular formation. Reinforcing. If you have seen a lion following you, will you fall asleep? No. So we'll become alert and aroused. How does that become? By decreasing the threshold in the reticular formation. So we become alert, and whatever sleep we have got, everything will go away. So we will become alert and aroused. Okay, next one. Increasing glycogenolysis in the liver. We want everything, glycogen, everything should be converted into glucose in the liver, and lipolysis in adipose tissue. This, in presence of lipase, this lipolysis means it should give away free fatty acids. So we need lot more energy. So lot of energy we get for your skeletal and cardiac muscle by increasing your blood glucose and free fatty acid levels. So we want energy to run or to fight. So increasing the energy by glycogenolysis in the liver and lipolysis in the adipose tissue, thus supplying more energy for skeletal and cardiac muscle by raising the blood glucose and free fatty acid levels. So everything will be converted into glucose. So glucose and free fatty acid levels to keep our energy up. So if you can remember these points, you can write an essay. So whenever you are scared, what is happening? Whenever you have seen something or scared, somebody is following you, what is happening? So this is, we look at things more clearly and our heart rate goes up. When heart rate BP goes up, and by going that, more and more blood is coming into your heart, and also by vasodilatation of the skeletal muscles is happening and limiting the bleeding, because by constricting the blood vessels, not much blood is coming out, and you become alert and aroused, and everything in the body is getting converted into glucose and free fatty acid levels for us to fight with the situation. So if you remember these points, we can write about the actions of catecholamines. So you remember one word, catecholamines are fight or flight response, and during emergency situations these catecholamines are released to cope our body during stress. Release of epinephrine and norepinephrine. Situations. Okay, when should epinephrine release? When should norepinephrine get released? Okay, situations which are challenging, that is situation with which the individual is familiar with, are associated with increased norepinephrine secretion. So what example can I give you? Situations which are challenging. Okay, now as a student during final year exams, you are sitting in an examination hall. You are familiar with the situation. What is that situation you are familiar with? You are sitting in the examination hall. Question paper will be given to you and you are supposed to write the answers. You are familiar with the situation. So during that situation, norepinephrine secretion will be released. Any secretion will be there. So you know, but it is very challenging situation because you are praying to God, saying that whatever syllabus I have read, the question should come from that syllabus. It's a challenging situation, but you are familiar with the situation. Okay, so that time it will be norepinephrine secretion. That is norepinephrine. Situation of an unpredictable nature. Situation in which individual does not know what to expect are associated with increased epinephrine secretion. So what is that? You are walking in a park and suddenly you see a snake in front of you. So you do not know how to react to it, because we have not predicted that would happen. We do not know what to expect from that situation. Situation of an unpredictable nature. So situation in which individual does not know what to expect from it are associated with increased epinephrine secretion. Okay. So what are these plasma levels? So norepinephrine is about 300 picograms per ml. Epinephrine is about 30 picograms per ml. Dopamine is about 35 picograms per ml in the plasma. That is when you are lying in recumbent position. But when from lying, if you stand up, they increase by 50 to 100%. They increase, and they stay. Their half-life is about 1 to 3 minutes, and they get metabolized in the liver and the kidney. So these are, when you are lying down, these are the plasma levels. But when you stand up, they increase by 50 to 100%. So these are the normal plasma levels. Coming to the next slide. What are the effects of catecholamines? It is similar to that of sympathetic nerve stimulation. So whenever sympathetic nerve are stimulated, adrenal medulla gets activated and release the catecholamines. But sympathetic, most of them, however sympathetic system is stimulated, both the actions are almost the same, but they can function independently of each other also. Okay, so whenever sympathetic system is stimulated, adrenal medulla is stimulated and it will release the catecholamines. Okay, so two types of adrenergic receptors are there. They are alpha and beta. So alpha and beta receptors are there in our body. Two types of adrenergic receptors are there, alpha and beta. Alpha adrenergic receptors are sensitive to both epinephrine and norepinephrine. Alpha are sensitive to both epinephrine and norepinephrine. These receptors are associated with the most of the excitatory function of the body. Excitatory means constriction function of the body, with at least one inhibitory function, that is intestinal motility. So everywhere it is excitative alpha adrenergic receptors that we are talking about, alpha adrenergic receptors. Most of the functions is excitatory functions of the body with one inhibitory function, that is intestinal motility. Inhibitory function of the intestinal motility means your secretions will be motility of the intestine and secretions will be less, intestinal motility. Beta adrenergic, it is beta not B, it is beta adrenergic receptors respond mainly to epinephrine. Beta adrenergic receptors respond mainly to epinephrine. These receptors are associated with most of the inhibitory function of the body with one important excitatory function, that is excitation of the myocardium. So beta adrenergic, most of the functions are inhibitory, but one important excitatory function is it is exciting the myocardium. So excitation of the myocardium means it will increase the rate of the myocardium, means heart rate will increase. Then it will increase the conduction of the impulses. Contraction of the heart means a lot of venous return. Okay, so conduction, contraction, excitation, and one more thing will be there. So these are got the names. They are called as bathmotrophic effect, chronotrophic effect, ionotronic effect, ionotrophic effect, dromotrophic effect. When you do the CVS, you will know. So, whenever sympathetic system is depressed, this positive effect, positive ionotrophic, positive chronotrophic, positive bathmotrophic, and positive dromotrophic. Okay. Summary. So, epinephrine is acting equally on both alpha and beta adrenergic receptors. I said alpha adrenergic receptors are both to epinephrine and norepinephrine. So, epinephrine acts equally on both the receptors, alpha and beta adrenergic receptors, while non-epinephrine acts only on alpha receptors. The same thing, summary. Norepinephrine, alpha is, I said, to non-epinephrine also. So, norepinephrine acts only on alpha receptors. Okay. So, alpha receptors main function is excitatory, but one inhibitory function is to the intestines. Beta is inhibitory, but one excitation is to the myocardium. So coming to the next slide, alpha receptors are of two types. Now the music starts. Alpha receptors are of two types, alpha 1 and alpha 2. Alpha 1 receptors are located on the postsynaptic membrane and are, for timing you remember, presynaptic membrane, postsynaptic membrane. Okay, so alpha receptors are located on the postsynaptic membrane and are mainly excitatory. Okay, where are they present? In the blood vessels. So whenever they get stimulated, there will be constriction of the blood vessels. And in non-pregnant uterus, what function it can have? It will shedding of the endometrium because of spasm of the spiral arteries. Spasm of the spiral arteries, shedding of the endometrium. This is what is happening during your menstruation. So, at a non-pregnant uterus, okay. So, alpha receptors, alpha 1 are present in the blood vessels and on non-pregnant uterus. Alpha 2 receptors are located on the presynaptic nerve terminals of cholinergic and adrenergic nerves. Cholinergic and adrenergic, Usually presynaptic ganglionic fibers are all cholinergic. Postsynaptic can vary. They could be cholinergic or adrenergic. Okay, when you do this autonomic nervous system, you will know it in a better way. Okay, so alpha 2 receptors are located on the presynaptic nerve terminals of cholinergic and adrenergic nerves. Activation of alpha 2 receptors is inhibitory. Alpha 2 is inhibitory. Inhibitory mainly to your GI tract. Means it will decrease the intestinal movement. It will decrease its secretions. Okay. Beta receptors are of two types, beta 1 and beta 2. Both are located mostly on the postsynaptic membrane sites. Both are located on postsynaptic membrane sites. Beta 1 receptor occur in cardiac muscle and their activation produces tachycardia and increased myocardial activity. It will increase your heart rate and increase myocardial activity, and force of contraction of the myocardium increases. That means there will be more cardiac output. When more cardiac output, more venous return will be there. Okay, so increased myocardial contractility. Beta 2 receptors are typically those associated with relaxation of smooth muscle. Relaxation of the smooth muscle. Example is skeletal muscular blood vessels. So vasodilatation of the skeletal muscular bed will happen. Okay, when you are exercising or running or okay. So example in skeletal muscular blood vessels, in GIT relaxation of the GIT will be there, and bronchioles. Bronchioles means bronchodilation will be there in the lungs, and bronchodilation. In humans, beta adrenergic mechanism predominates. So in humans, beta adrenergic mechanism predominates over alpha mechanism. Beta adrenergic mechanism predominates. Okay, so beta 3 receptors are also there. Okay, their action we do not know much. Beta 1, beta 2, and now they are saying beta 3 are also there. Okay, so here mainly whenever we say alpha are excitatory, but one inhibitory function. Beta are inhibitory with one excitatory function. Roughly, if you remember that way, you can understand this. So actions of catecholamines. How are these catecholamines are acting all over the body? So if you remember what should happen in fear or flight response, you can write the actions of catecholamines. So what should it happen on carbohydrate metabolism? More glucose should be liberated for us to have energy. So everything will point to that only. So on carbohydrate metabolism, catecholamines stimulate hepatic glycogenolysis by activating glycogen phosphorylase. So glycogen will get converted to glucose. So end product is glucose is increasing by that pathway. They stimulate glyconeogenesis from other sources, also from lactate and amino acids in the liver. And again, the glucose is coming from the other sources, from lactate and amino acids in the liver. They inhibit glycogen synthesis because they do not want glucose to get converted to glycogen. They inhibit that glycogen synthesis. They stimulate glucagon. Glucagon acts exactly opposite to insulin. They stimulate glucagon means hyperglycemia. More of glucose will be liberated into the blood. They stimulate glucagon and inhibit insulin secretion from pancreas. That means again more glucose is there. If it stimulates insulin means less glucose will be there. So it is stimulating the glucagon and inhibiting the insulin secretion from pancreas. So all these effects are primarily aimed to increase your plasma glucose concentration. So on carbohydrate metabolism, initially only I told you all glycogenolysis will be there. So we want glucose. So all these mechanisms will lead to increase in the plasma glucose concentration. Okay, this is on carbohydrate metabolism. Now coming to fat metabolism. What should happen in fat? More of free fatty acids and glycerol should be there in the blood. So on fat metabolism, catecholamines promote lipolysis. Lipolysis by activating lipase in adipose tissue that causes breakdown of triglycerides and increase plasma free fatty acids and glycerol. Our end product is free fatty acids and glycerol should be increased. So it is happening by promoting lipolysis, by activating the enzyme lipase in adipose tissue. Catecholamines promote formation of ketone bodies by beta oxidation of free fatty acids in muscle and liver. By oxidation, so it will formation of ketone bodies. Okay, so catecholamines are therefore pro-diabetogenic and pro-ketogenic hormones. You remember this word, catecholamines are pro-diabetogenic and pro-ketogenic hormones. Okay, now we have finished about carbohydrate metabolism and now we have finished about the fat metabolism. Okay, now coming to on CVS, what should happen? So everything, whenever you are running, what should happen? Everything should go up. Okay, catecholamines increase force of contraction, rate of contraction, cardiac excitability and conductivity. These are the 4 words I told you: bathmotrophic, ionotrophic, chronotrophic and dromotrophic. Each one will have 1 word. So all sympathetic means all are positive. When parasympathetic is stimulated, all will become negative. Okay, so so on CVS, all this will, your heart rate, you'll have tachycardia, force of contraction, your conduction will increase, everything. Okay. Effect of epinephrine on, it will increase the heart rate and force of myocardial contraction. So increases the systolic blood pressure. I told you heart rate into stroke volume is cardiac output. So whenever cardiac output is more, your systolic blood pressure will increase. Okay, and it will have vasoconstriction effect of arterioles in renal, splanchnic and cutaneous vascular bed. Vasoconstriction is occurring in these vessels. In renal, splanchnic means your GIT vessels. So in renal, splanchnic and cutaneous vascular bed. But vasodilatation is occurring in skeletal and hepatic circulation via beta 2 receptors. So vasodilatation is occurring in skeletal and hepatic circulation. Where other places, everything vasoconstriction is occurring. Okay, so vasodilatation effect, I told you beta has got a beta effect in human beings is predominant than the alpha effect. So vasodilatation effect overrides the vasoconstriction effect. So vasodilatation is happening. Whenever vasodilatation is happening, your peripheral resistance decreases. So diastolic blood pressure decreases mildly. So whenever peripheral resistance falls, your diastolic blood pressure decreases. So your systolic pressure is increasing here and diastolic pressure is falling. So your pulse pressure, difference between these two pressures is the pulse pressure, that is widening. Supposing systolic is 120, it has gone to 150. The diastolic, which was 80, might have gone to 70, 75. So this difference between the systolic and diastolic blood pressure is the pulse pressure. That difference is increasing. Usually it is about 120 by 80 means it will be about 40 mmHg will be your pulse pressure. Here it might increase, it might become to 60 or 70. Okay, the pulse pressure gap is increasing. And exercise and here one more thing what I want to tell you. I told you vasoconstriction is occurring in renal, splanchnic and cutaneous vascular bed. Why? Here because vasoconstriction is occurring and all these organs like your kidney, your GIT and cutaneous, they are diverting the blood to your skeletal muscle. There vasoconstriction is occurring, but they are diverting the blood to your skeletal muscle, because when we are running, the blood should be good to your skeletal muscle, your heart and coronary circulation. So coronary circulation, cardiac circulation, all this should be maintained. So they are vasoconstricting in those places and diverting the blood to your skeletal muscle and increase so that your cardiac and coronary blood is maintained well. Okay, cardiac and coronary So this is what is happening during your exercise also, whenever you are exercising, and this is happening during your fight or flight response, during stress. So exercise and stress, this is exactly what is happening. So whenever we do this BP practical also, we tell you whenever we are running and exercising what is happening. Okay. So this is what is happening in exercise. So at some places vasoconstriction is occurring. Vasoconstriction is occurring because different receptors are there. So vasoconstriction, probably because alpha receptors are acting there and vasoconstriction is there. Vasoconstriction of arterioles in renal, splanchnic and cutaneous vascular bed. So that blood is diverted into your skeletal and hepatic circulation so that we can maintain your cardiac and coronary circulation also. Okay, so vasodilation. So this is what is happening during exercise also and during stress. Some line is following you, so you are under stress. All this is happening. So this helps during our fight or flight situation. All this energy and blood to the skeletal muscle is coming from these sources. Effects of norepinephrine. Norepinephrine produces vasoconstriction via alpha receptors. So vasoconstriction means your peripheral resistance increases and your diastolic blood pressure increases. Okay. So peripheral resistance, you remember that word for time being. Whenever peripheral resistance increases, your diastolic blood pressure will increase. That is the resistance of the vessels to flow of blood. Okay. So norepinephrine produces tachycardia. It is increasing your heart rate, everything, and increases myocardial contractility. So systolic blood pressure also rises. So when both systolic and diastolic blood pressures are rising, this baroreceptors get activated. That also we will talk in CVS. Baroreceptors will activate. When these baroreceptors are activated, it will decrease your heart rate and it will decrease your cardiac output. Though your peripheral resistance is more, in spite of that, it will decrease your heart rate and decrease the cardiac output. So initially where tachycardia was there, now it will, baroreceptors, will talk to it. It is a big chapter. We'll talk about it in the later classes while doing with the CVS. And particularly your blood pressure mechanism. So whenever this our body is so beautiful, it will try to control on its own. It will try to regulate on its own. Okay. So baroreceptor mechanism is stimulated and it will bring about the bradycardia, decreased cardiac output in spite of increased peripheral resistance. So I told you effects of on CVS, effect of epinephrine and norepinephrine on CVS. Okay, now on CNS, it shows stimulatory effect on CNS. So stimulatory effect, whenever you come to Viva or writing the exam, what will happen? Anxiety, apprehension and coarse tremors of extremities. Do you witness all this during examinations? Yes, because there is stimulatory effect on the CNS which causes anxiety, apprehension and coarse tremors of extremities. It acts by activating the reticular activating system. Reticular activating system is also a different topic. It acts by, it will activate this. So that is why it will decrease the threshold of the system. That is why we become alert and aroused. Okay, so CNS. So what will happen on CNS? Okay, next on eyes. On eyes, I think I told you before, via alpha receptors causes contraction of the radial muscles. Whenever radial muscles are contracted, pupils will dilate. So these are the muscles of the iris, radial muscles and circular muscles, sphincter pupillae and dilator pupillae. Radial muscles are also called as dilator pupillae. So whenever they are stimulated, pupils will dilate, cause mydriasis. Via beta receptors, there will be relaxation of the ciliary muscles. Relaxation of ciliary muscles, I told you, when the ciliary muscles are relaxed, suspensory ligaments will become tight and the lens will flatten so that we can see the far away things. So all this will maintain the tone of the eye muscles also. So both results in wide open of eyes. You just imagine a lion following you. So will you fall asleep? Never. So this is the mechanism. Via alpha receptors, what muscles are getting contracted? Via beta receptors, what are happening? So both results in wide open of the eyes, letting more light into the eyes so we can visualize the things in a better way. So this is happening on eyes. Then what is happening on GIT? I told you it will inhibit the gastric secretion and motility. Gastric secretion and motility. So whenever we are running in fear, gastric secretions are less and motility is also very less. Okay. On urinary bladder. On urinary bladder, what should happen? So if supposing some lion is following you, do you want to go and pee? No. We want to protect ourselves. We want to run. So what does the urinary bladder do? Via beta receptors, it causes relaxation of the detrusor muscle. Relaxation of the detrusor muscle means it can hold urine. And via alpha receptors causes contraction of trigone and sphincters. So that dribbling of the urine is not there. It will contraction of the trigone and sphincters. That means finally both these effects will produce retention of urine. If it was contraction of the detrusor muscle and relaxation of trigone and sphincters means urine will come out. So it is happening. So we want the urine to be retained in the urinary bladder. So finally produces a retention of urine. You don't feel like going to the toilet when something scary is happening around. So via beta receptors causes relaxation of the detrusor muscle and contraction of trigone and sphincters. Retention of urine. On skin, what will happen to skin? Whenever something scary, your piloerector muscles will contract. Your hair will stick out like that. So catecholamines via alpha receptor causes contraction of the pilomotor muscle to cause piloerection of hair. Hair will stand up whenever we are scared. Hair will stand out. Contraction of pilomotor muscle to produce piloerection of hair. On sweat glands, they produce localized sweating and on palm and sole called adrenergic sweating. Sweating is there during exams or viva. What is happening? You sweat on your palms and soles. That is called adrenergic sweating. When sweating is there all over, it is called generalized sweating is cholinergic sweating. So this is adrenergic sweating on palms and soles. Okay. So all this, if you relate something scary, you can write everything. So that is only fight or flight response. That one word, fight or flight, you can write an essay about the actions. On skeletal muscles, what should happen? We want more blood supply to the skeletal muscle. So via beta receptors improves skeletal muscle blood supply. But at the expense of constriction somewhere else. Okay. On bronchial muscles, via beta 2 receptors relaxes bronchial musculature producing bronchodilation will be there. Bronchodilation will be there. On kidneys, catecholamines increases sodium and water reabsorption from kidneys. What do you understand by sodium and water reabsorption from kidneys? Means from the from the cells of the renal system, sodium and water is entering from the kidneys into your blood. So so water is entering, sodium and water reabsorption is there from the kidneys. So your blood volume will increase. So your blood pressure will increase. So it is water reabsorption is occurring from the kidneys towards your blood. So it is through the interstitium, it is coming into the blood. So water and sodium is entering into the blood. So your blood volume is increased. So that will increase your blood pressures. So how does it do? By stimulating renin-angiotensin aldosterone mechanism. So renin, this cells renin is produced in the juxtaglomerular cells. So renin, angiotensin, aldosterone mechanism. All this we'll tell in excretory system. By stimulating renin, angiotensin, aldosterone mechanism, catecholamines increase sodium and water reabsorption from the kidneys. Sodium and water is coming into your blood, into the plasma, blood volume. Okay, this is what is happening on kidneys. Next, dopamine. Little bit about dopamine. One important word you should remember about dopamine is everywhere it produces vasoconstriction by releasing from dopamine norepinephrine to epinephrine only. So produces generalized vasoconstriction by releasing norepinephrine. So everywhere vasoconstriction is there. But one more sentence is that by an action on beta 1 receptors, it has positive inotropic effect on heart, increasing the heart rate. So increase the systolic blood pressure and no change in diastolic pressure. This is very important about dopamine. No change in diastolic pressure. I'll tell you why. Therefore, it is very useful in the treatment of shock. So it is very useful in the treatment of shock. No diastolic blood pressure, no change in diastolic blood pressure because peripheral resistance is decreased. There is vasodilation in the blood vessels when you give dopamine. So diastolic blood pressure does not increase. So on kidneys, it will act via specific dopaminergic receptors producing vasodilation. So everywhere DOPA is vasoconstriction except on kidneys via that specific dopaminergic receptors it produces vasodilation. So if there was vasoconstriction in the kidneys also, everything vasoconstriction means what would have happened? Acute tubular necrosis of the kidney and kidneys would have shut down. Kidneys would have shut down. So when kidneys have shut down is urea, everything will be increased in the body and person will die. So it has got vasodilation effect on the kidneys so that it will prevent acute tubular necrosis and renal shutdown. Okay, so that is why this is very useful in the treatment of shock, circulatory shock. Usually they give DOPA so that kidneys can function and it can remove the excretory substances, unwanted substances can be sent out through urine by the kidney. That is why they give DOPA in shock, in circulatory shock. Okay, so this is very important word about kidneys. Everywhere vasoconstriction except on kidneys it brings about a vasodilation. Because it brings about a vasodilation, your diastolic blood pressures do not change. And this is very useful in the treatment of shock. If you want your kidneys to function properly, you give DOPA. Applied aspects. Hyposecretion of catecholamines. What hyposecretion means? When catecholamines are not produced in the body. Supposing there is TB of the adrenal medulla. Adrenal medulla has got tuberculosis or destruction of adrenal medulla. There is some malignancy. So adrenal medulla got destroyed. Or you have done an adrenalectomy. Okay. So produces no clinical signs and symptoms. Why? Because adrenal medulla is not essential for life. Because this catecholamines, I told you, they are not only produced from the adrenal gland, but I told you there are sympathetic adrenergic receptors are there. So sympathetic adrenergic receptors, they can they produce adrenaline and noradrenaline, how much is required by our body. But sympathetic noradrenergic neurons will synthesize only noradrenaline. But sympathetic adrenergic neurons, they synthesize both adrenaline and noradrenaline. Okay, so these catecholamines are coming from somewhere to fulfill our body needs. So we can say we can survive even without adrenal medulla. It's not essential for life. What are hypersecretion of catecholamines? It is hypersecretion. This chromaffin cells, sometimes they lead to tumors of these chromaffin cells. It is seen in tumors of chromaffin tissues called pheochromocytoma. Tumor of this chromaffin cells of adrenal medulla is called pheochromocytoma. Mainly the biggest problem, these are usually benign tumors. Yeah, it's written there. These tumors are usually benign and contain large amount of both epinephrine and norepinephrine. So mainly because of this catecholamines have, most of these catecholamines have vasoconstrictor effect. So sustained or paroxysmal hypertension will be there. These people will have BP like 300 by 200 mmHg. Because of vasoconstrictor, all your BP rises. Okay, so 300 by 200 mmHg. There will be headache because of this vasoconstriction only. Headache will be there. Sweating in the palms and soles. Severe palpitation, increased heart rate. One is aware of one's own heartbeat. Severe palpitations. Substernal pain will be there. Anxiety, I told you, anxiety, weakness, dizziness, pale, cold and moist skin. Blurred vision, because the pupils are dilated, they can't even see properly. Blurred vision due to dilated pupils. There is increased body temperature. There is increased body temperature. Hyperglycemia, lot of glucose is there. So hyperglycemia, this might lead to diabetes mellitus. Glycosuria, lot of glucose is lost in the urine, and increase in BMR. All this will, basal metabolic rate also will increase. Basal metabolic rate is increased, your body temperatures also will increase. And increase in urinary excretion of catecholamines. That is how they are diagnosed. Their urine sample is taken and they excrete a lot of these catecholamines. This particularly metanephrines and vanillin mandelic acid, all this. So biggest problem of this is hypertension. They'll have a lot of hypertension day in and day out. Okay, so this is about pheochromocytoma and little bit about your applied aspects. I think I'm done with this. Yeah, hopefully you understood. So if you just can remember fear or flight response, you can write everything. Where is this adrenal medulla present? What are chromaffin cells? What do they release? So during challenging situations, what will happen? Unpredictable situation, what will happen? So if you know this, you can write everything. Hope I am clear. The inner part is the medulla. Okay. So it is preganglionic cholinergic innervation, splanchnic nerves. Preganglionic cholinergic innervation. Postganglionic fibers are not there. They become endocrine cells or secretory cells, and they release their secretions into venous sinuses or capillary, sort of a capillary. Okay. So what do they secrete? How they are metabolized? Degradation, where does it occur? And when do you see, in what conditions do you catecholamines are released? Okay. So a little bit about fight or flight response, levels, catecholamines, how because of the two receptors are there. And also on carbohydrate, I told you easy way to remember what should happen on CVS, what should happen on CNS, on eyes, on GIT, bladder, skin, skeletal muscles, bronchial muscles, on kidneys. Okay. And DOPA. DOPA, here you should remember only that word. It is vasodilation effect to the kidneys. Everywhere vasoconstriction. Okay. Applied aspects is pheochromocytoma. Okay. That's it from me. Thank you.